Hi, everyone. My name is Eileen Dunne. I'm a microbiologist and epidemiologist working in vaccines. I currently work for Pfizer, and I've had previous roles in academia and government. My leadership project is focused on the representation of women in industry-sponsored advisory boards and conference symposia. I conducted my project at Pfizer with a focus on vaccines. Pharmaceutical companies such as Pfizer work with external experts known as key opinion leaders or KOLs in a couple of different ways. One of which is through advisory boards in which external experts provide their opinions and advice on vaccine development, vaccine policy, and other topics of interest. Another is through conference symposia. These are industry-sponsored speaking events in which an external speaker will give a presentation on a scientific topic. Both of these activities are considered influential and prestigious, and traditionally women have been underrepresented, particularly women from low and middle income countries. The ultimate goal of my project is to increase the representation of women and general diversity in KOL activities at Pfizer. My project had two components. Firstly, I gathered data on KOL demographics during 2025. And secondly, I conducted stakeholder interviews with internal stakeholders using a structured set of questions on KOLs, representation of women, barriers, and potential solutions. And now onto the findings. I reviewed data from 485 KOL engagements. 36% of them were women, confirming that women remain underrepresented in these activities, with only about a third of them conducted by women. There was some variation by topic as well as by geographic region, with the majority of KOLs from North America and Europe. I conducted 10 stakeholder interviews and some common themes arose. All of the stakeholders agreed that Pfizer could benefit from increasing representation of women and diversity in advisory boards and conference symposia. Several barriers were noted. Primarily, the pool of senior professors and recognized external scientific experts is still predominantly male, and women KOLs can be in high demand, and sometimes contracting can be challenging. For example, women who work at organizations or governments that cannot engage with industry. Several stakeholders often also mentioned over-reliance on usual suspects, in that our workplace tends to bring in the same KOLs over and over. Suggestions for increasing representation of women included conducting internal trainings and raising awareness, as well as initiating efforts to bring in new voices. Overall, I've had a fantastic experience with the WomenLift journey. I'd like to acknowledge that it's been a very difficult year for the global health sector due to the US political situation and funding cuts. Many of my cohort members have either lost their jobs or had to change jobs over the course of the year. I've really appreciated the community during these difficult times and being part of a group of women who care deeply about global health and have been able to support each other. While I personally have not been impacted by job loss, there has been uncertainty in my workplace with frequent layoffs and reorganizations. And partway through the year, I was put in a new role in a team lead position overseeing a team of scientific experts covering 5 vaccines. I was able to draw from the training and materials that I received during the WomenLift journey, particularly during immersion, to help me be successful in my new position. And I really appreciated the focus on authentic leadership, taking the time to reflect upon my own values and core personality to think about what sort of leader I aspire to be and what sort of career I'd like to have moving forward. I'm looking forward to seeing everyone at Liftoff, and I'm very grateful to have been able to join the WomenLift community. And I hope to continue progressing on my project and my goal of increasing representation of women in the vaccine sector. Thanks very much.